Welcome, Lesley and Neal. Thank you so much for joining us today. I was just wondering if you could give an overview of how you reached this point and how you reached, I guess, out to beat and giving your story today.
Our daughter had type 1 diabetes for 10 years. And it was only after 10 years we realised that she had been suffering from diabulimia, or as it's now known, TIDE, for most of that time. Unfortunately, our story isn't a very optimistic one, because at the end of the 10 years, she successfully managed to take her own life after being in treatment for a year. So we realised then that what was available to help wasn't anywhere near fit for purpose. And we have spent the time since trying to bring that help up to standard as best we can.
Thank you, Lesley. And I think getting to know you both over the last 6 months, I'm really grateful for your input, and we need to hear Megan's experience to change things for the future. So leading on from that, what sort of support can health professionals offer friends, families, carers in this situation, do you believe?
Although we acknowledge that more could and should be done with regards to the awareness of eating disorders, type 1 diabetes and mental health, the fact is that there are existing NHS treatment pathways for all three. However, when they coexist, due to the fact that TIDE is not recognised as an official standalone condition, access to the appropriate care is sadly lacking. I mean, all healthcare professionals need to be made more aware of TIDE so that information can be given to all those impacted, especially immediately after a type 1 diagnosis. Early intervention is obviously key. So having a comprehensive breakdown of this autoimmune disease, including details of TIDE, is essential. Type 1 maintenance has life-changing consequences, and the association between insulin and weight gain puts real pressure on concerns over food intake.
I think we need people to understand that it's a standalone condition and that it needs specific treatment for it. That the sufferers won't necessarily fit the typical image everyone has of somebody with an eating disorder. That if you're given conflicting advice and instruction, which can often be the case from the two camps, it's demotivating and it's very, very frustrating because you just don't know what to do. So it would be helpful if the health professionals could work out what they wanted someone to do, rather than it getting put on them to try and work out what the middle path was. And I think if somebody will have had a pre-existing condition, you've got to explain this is new. All the old rules that you were following have got to go. And obviously the parents, the carers, the friends, they will have been used to seeing someone behaving in a certain way, and they need to know that that's going to have to change. There's a likelihood, I suppose, of if you've got type 1 diabetes, with all the cultural pressures, you're going to tip over because the opportunities are there. It would also help if you got all the practicalities explained, how you test, what you're looking for, what the machineries are, what the levels should be, so that you can understand and help your person that you're trying to support. Parents should be treated as a resource. We found that nobody would talk to us, nobody would listen to us, and yet we had a lot of what we thought was useful information. But you need a secure pathway that is open so that you know who to talk to. You need to explain what people should expect, because this is going to take time, and so parents need to have realistic expectations, and give people enough information to keep the person safe, so you can be very much left on your own if someone is with you for a visit or whatever, if they've been in an inpatient facility, and you need the information to do the right thing by them. So I think that's about covered most of it.
I was going to say that's perfect and such a good outline of things that would help. Leading on from that, I mean, what would you say? I mean, you've talked a little bit about education there, but what sort of education would be useful for carers, parents, friends, families, in really learning to equip them on how to talk to their loved ones about this?
Well, if carers have access to condition-specific information as a consequence of type 1 diagnosis, then you can start having those appropriate conversations with loved ones, and that can start immediately. Providing the interaction is not confrontational, accusatory or judgmental, then a trusting relationship can be established from day one. This needs to be mirrored as well by the way the medical profession interacts with patients, so that that network of support from all sides has a better understanding of TIDE as a condition in a very sympathetic way.
I mean, the language you use is important. The words can have real effect if they're positive or negatively phrased. And it's how to ask. It would be helpful to know how you can ask the person what's going on without seeming that you want to control or you don't trust, because you want to find things out, you want to help, you want to support, but you don't want them to feel that you're overbearing in any way. And an explanation of all the correct terms and the names of things and what they mean and what they do, so that you really understand what's going on, and then you can pick up on things a bit quicker as well.
That's such useful feedback, and language is something I hear time and time again that is such an issue with this illness. So I think it's brilliant that you've highlighted that. If we talk about peer support, obviously talking to others who've been through this, as a carer, what would they want? What would you want from that peer support?
Well, one of the adverse consequences of sort of TIDE in general is this feeling of isolation, especially as parents. Talking to people who are going through similar circumstances would provide comfort and a greater empathy for what is required to support those sufferers. I mean, everyone's story is going to be unique, but there will be common themes that resonate, giving carers a better understanding of the condition and the impact it will have on families. However, not all conversations are going to be constructive. So we think it's imperative that peer group sessions, if they're going to be held, are professionally conducted by someone who's TIDE aware. Having comprehensive condition-specific knowledge of this condition is vital at all stages of the treatment process. And if a TIDE sufferer trusts both the medical profession and their carers, then there will be improved outcomes.
Yeah, I mean, it's a complicated condition, not particularly high profile. So talking to people who understand, and when you're explaining things, I mean, that's incredibly important. I mean, there's also practical things. It's really hard to find help. So if you're in a group of people that have gone down that path a bit, they can give you some guidance on where to go. It's not a perfect system, and you might want to know what your rights are. And again, if somebody's been down that path, they can explain what questions you should be asking, maybe, who you should be asking them for, the people you want to be talking to. And technology moves on. And so if you're in a group of people, there might be hints and tips on what new technology is available for you to use. And all of that could be incredibly helpful, so that you're going in with an information base, which can only help you.
That's so important, and an interesting reflection, in terms of the peer support group that we've run here in Dorset. They so often talk about technology and of like, oh, you've got a new Libra, or you've got this one, or you've got this new fast-acting insulin. And so often they'll find out that information from one another. So that totally resonates with my experience of being involved in the peer support group. Lesley and Neal, thank you so much for sharing so eloquently, and we're delighted that you've been able to join us for this Beat conference. It's really part of our agenda to look into this issue, provide more support from the charity. So thank you so much for taking the time to be with us today.
It's our
You're very
pleasure.
welcome.
It means a lot to us as well.
Thank you.